Right shoulder raised, right shoulder blade, right pelvis, left pelvis. Bend forwards. How are we there? Is that okay?
Okay.
Come up. Bend backwards. How is that for you? It's okay? Any pain? Yes
a
or
little
no?
bit, a little bit.
Little bit. Slide your hand down this side. When I press here, how is that? It's okay?
Yeah.
This side, how is that?
No pain.
Okay, have a seat for me, please. Turn your head to the right, to normal position. How are we into this? Is okay?
Pain's a little, yeah.
Little pains a bit there. How are we there?
No pain.
Okay. Right then. So, when we first met, you described this pain going across the lower back. Yeah, you were suffering. You were not happy. I could tell. Yeah, yeah. So we've initiated some care. You've been coming the last couple of weeks for us to correct the movement in the spine to help your body work better. How is your back compared to how it was? Just remember how you were suffering then. Right now, would you say it's worse than before? No, different or better?
It's better. It's better.
How is it better? What would you say?
Mobility is better, flexibility. It's pain is when I bend forward, there is a pain. But
so you talk about flexibility. How is that better? Well, what are you noticing now?
I'm able to, like, after your exercises, I'm able to turn my head. Earlier it was a little tough for me to even
Turning head where?
turning left side, right side.
In the car, driving? Or
Driving, yeah, especially while driving.
Okay, driving. So driving is easier when
Easier.
turning your body. Yeah? And you're noticing it's not causing that
Yeah,
irritation.
earlier I used to really suffer while looking behind, so now it's easier.
Is that positive?
It's positive.
Okay. What about like bending and twisting, like getting into the shower or getting out of bed? And how is that for you?
It's better, but still there is a pain.
So is that pain there to the same degree? That's why, or is it less than before?
It's less than before.
It's a good sign. That's a good sign. Is the pain waking you up at night?
No, I don't have.
Good. When you get up in the morning, are you able to get up and?
Yes.
Okay, great. So this sounds positive. When you mentioned you've also, when you were driving and bending, you particularly mentioned this. Yeah? It was causing you problems. Now you're driving and it's
Driving,
okay?
it's easy. I mean, I don't have that difficulty looking at the heart blind shoulder, blind side. No?
Excellent, excellent. Let's have you stand. Let's see you bend forward. You just showed me just now. That seems to be okay as well, yeah? So have a seat for me. So that bending is also seeming to be okay, which was initially causing you a lot of issues, okay? So you, from what I'm observing, we are seeming to go in the right direction.
Yes, yes.
So how much better is that pain, that condition, compared to how it was, how you were suffering, and now? How much better would you say? Well, if you were to give, because I'm seeing you're doing really well.
Better in sense like almost 20-30%, 40% better.
I see. All right. Okay. Good. 40% better. So you're saying you're 60% still limited. 60%. So tell me how that 60 where that you're 30% better, but there's 60% still issue in your body. How are you limited?
It's 60% back. When I suppose I'm at the sink, so when I bend for 5 minutes, when I'm just standing, not bending exactly, a slight position, then I start getting a pain here.
You start getting a pain there, yeah? So in your mind, you still feel 60% limited.
Limited.
Really? That much? Because I'm seeing you're active, you're getting out of bed.
Sometimes it is painful.
Because
but otherwise it is.
Because the problems you told me about, they're not seeming to be there now.
A lot. There's a lot of difference. But then I have, in the morning especially.
So
I don't use the shower, I use the bucket. So that particular time, sometimes I feel that pain.
You're feeling the pain into there, yeah? Alright. So,
but otherwise it's not, generally it is not painful, only in the mornings.
Can you see progress in your body? Can you see that you're going in the right direction, or do you feel you're going in the wrong direction?
No, in the right direction.
So if there was somebody else that was suffering like this, they had an issue, what would you advise them? Would you think it's a good idea to come here?
Yes, definitely.
You're doing very well, sir. You're moving exactly as according to schedule. And if you keep up with all the exercises that we advise, only take a short time, 5 minutes a day.
Yeah, 5 minutes. I'm doing it 3 or 4 times a day.
Let's get it up to 5. It will be 5 minutes in the day, and you'll respond perfectly.
Yes.
Good stuff. Let's have you lie on your front, please. Face down. We're going to utilize some laser, alright?
Yeah.
1, 2, 3. Lie on your back for me, facing up. Give yourself a hug. Relax the arms. Perfect, sir. Coming up for you. Doing really well. Doing really well. You're moving exactly as I would expect at this stage of your care. God willing, may this continue. You'll be fine. You'll be fine.
Thank you so much.